Hello everyone, welcome to another episode of Psych Talk. Today I will talk about paranoid personality disorder, which is very interesting, like pretty much all the personality disorders to be honest. So this disorder, I will say that the main features are distrust and suspicions about the motivations of other people. They usually fear of being treated badly or being disliked by people, and it is a way for them to protect themselves from like being exploited, criticized, or feeling weak. So they kind of take this defensive type of stance when it comes to relationship. But the main characteristic of this disorder are pervasive mistrust of others from an early age, constantly doubting the loyalty of friends and family, holding grudges for past perceived misdeeds, and believing that others have malevolent intent, and withholding information out of fear that it will be used against them, and quick to anger if perceiving their character or reputation has been maligned, and being suspicious of their partner's faithfulness. This disorder is estimated to affect between 2 to like 4% of the population. And again, it's more common among men than women. And men with paranoid personality disorder have usually some of the most adverse outcomes of any personality disorder and are the least likely to be employed. And the ones who are employed, they usually have a lot of trouble at work. They might get in a lot of arguments and things like that. And so yeah, they're not. If they find a job and then get hired, they are most likely going to get fired. One interesting thing is that a meta-analysis of a non-clinical population found that this disorder, when combined with high rumination, uh, this paranoid thinking is associated with aggressive behavior, but only when provoked. So this individual can be aggressive if there is a lot of rumination and paranoid thinking, but only when provoked. The symptoms of this disorder may first develop during childhood or adolescence. And at first, they may appear like social anxiety or like kind of sensitivity, withdrawal, or isolation from others. And also, this like people with paranoid personality disorder may have been bullied for being odd or having like kind of different thoughts or fantasies. And they also may be underachievers in school. And to be a therapist and treat this type of disorder is very hard because you have to be very aware of your behavior and kind of avoid behaviors that may evoke suspicion, such as accepting phone calls from a meeting with like family members when the client is not present. So for example, accepting phone calls from the family members of the client when the client is not present. And also they neither should be like very warm because this might trigger like kind of suspicion, like why are you being so warm and friendly with me, right? And again, this is very hard to like treat or deal with, and usually we have to be very careful. We in therapy want to like kind of make the client feel like he's in charge. That's why we use more of a behavioral therapy type of approach, because it's more logical and organized, and the clients feel more like empowered rather than the therapists feeling more like in control. And so that may help with like concerns about like manipulation, and it can help the client kind of keep going to therapy rather than quit right away because of his paranoid thoughts of like being exploited or like brainwashed or whatever it is. Also, we might use cognitive therapy We can help the client with some sense of competency and self-esteem while also looking at the patient's like beliefs in light of reality, especially when there's a lot of like suspicions and this type of thoughts. And one thing that cognitive behavior therapy can help with is also with the black and white thinking. So people with paranoid personality disorder tend to overgeneralize, and they kind of think negatively about like people's intentions, and they have a very like black and white thinking. And so cognitive therapy can help with like give alternative explanations for other people's actions, right? So not everybody has like bad intentions, but um, and so yeah, with cognitive behavior therapy, we can give like alternative explanations for other people's action. So yeah, in summary, paranoid personality disorder involves a persistent distrust of others, um, with individuals often believing others are trying to deceive, harm, or exploit them without sufficient evidence. And that is it for today's episode.